Kusangpo and a very warm welcome to the English segment of the Current Affairs program. All the viewers must be aware that these days we have been bringing out one-to-one interviews with the new cabinet, and today with me I'm joined by the new Health Minister, Health Dechen Wangmo. First of all, welcome to the show and congratulations for assuming the new post and for being the lone female in the cabinet. Now, to start with, if you could firstly share about your academic background.
Thank you, BBS, for the opportunity and the platform. I would first like to express my heartiest gratitude to the people of my constituency, North Thimphu, and people of Bhutan for entrusting us with your trust and confidence. I'm very honored and privileged to be here. I finished my high school here in Bhutan, and then went and pursued my undergraduate in cardiopulmonary science, and then later did my public health epidemiology from Yale University in US.
So, what about your job experience?
After my undergraduate, I was actually planning to go into medicine. So I did my 2 years with Children's Hospital in Boston in cardiology, planning to get my degree in cardiology. Then I realized that being in the hospital was not my cup of tea. So I fell in love with public health research after working sometime in Central America as well, in Belize. And then I thought, I want to go and pursue public health. So then I went and pursued public health. And after graduating from Yale in 2007, I then worked as an international public health consultant, working in almost providing technical assistance to almost 8 countries in the region, including Bhutan.
Yes. So you never joined civil service here?
No.
Was it not something of your interest, working as a civil servant?
Initially, I actually was planning to join law, but there were certain things that I wanted to go and pursue my master's, and if I joined, then it was not allowed, and I already had a scholarship, so that didn't work out. So when I came back, of course, then I saw this opportunity because there were very few consultants in the market. Just myself and Dr. Thandi, I think, in public health. So I thought it's a good opportunity for me.
Your Excellency, if you could share about your personal interests, your talent and your strength.
I don't know if I have any talent, but I enjoy reading. I read books. I'm a very good cook. I cook very well. And then I think I really enjoyed. As a young kid, I was very much into martial art. So I hold a national black belt. Myself and Amjimi, we were the first women to ever award a Taekwondo black belt. So I was a coach in Taekwondo. Eventually, when I joined college, that passion sort of died out. Yes. I think now I'm too old to go back.
That's quite impressive. One thing is that since your interest was in public health, what was one subject that was very close to your heart?
I think since prior to my mother's diagnosis of cancer, HIV/AIDS is something that I was really moved and touched. So I spent quite a significant amount of time working on HIV prevention and treatment, and not only in Bhutan, in other part of the world as well. And then once when my mother was diagnosed with cancer, then sort of transition from that to cancer, and then I realized there's so much we can do in non-communicable disease.
Now, since you're in politics now, I think we should talk something about politics now. What motivated you to join politics?
Very interesting question. So, like I said in the Zonka session, I had an opportunity in the past second democratic election as well to participate, but it was never. I never thought that it's going to be my cup of tea. But this time, I think because DNT's main agenda was health, and that was something that was very close to my heart. So I said, And of course, Mijil Inchun and Dr. Tanti, their leadership that you look up to in all aspects. And both I have known them for many years. And these are two individuals that I greatly admire. So I thought it's an opportunity to work with them and bring a change about in the country with the way we deliver systems in Obe. So that was the reason I joined DNT.
So when you decided to join politics, what were some of the reactions from your family, your friends?
I think I would say partly most of my friends were surprised, but with my family, of course, I was in Zonka session. I was sharing this thing. Something with my dad is he's a man of few words, and he always entrusted us with decisions we made, and not just me, all of our siblings. So when I was talking to him about my decision to join politics, I remember his exact words were, serving the nation is not a child's play, and you must have utmost dedication, sincerity, and commitment. And if you can deliver this, then he said you must go forward. If not, then I think you must not participate. So then I realized that it is so true. We can't just jump into it because or suddenly there's nothing that I can do. I just want to hop onto that wagon. So it wasn't the case like that. So I reflected on what he said, and then I communicated my decision to him. And since then, I think he has been he and of course all my siblings have been instrumental in providing me with the love and support and all the guidance.
After you joined politics over your past few months, how did you find politics? Because these days people say politics is all about money and politics is dirty. So what's your stand on this?
I think it's very interesting because, to be very honest, I joined in sometime in July, I think. So I had very little time to actually analyze, So I was moment I joined, then I was thinking about, okay, let me try to understand people's concern. Although I am from North Thimphu, there were some constituencies that I have never been, to be honest. So then trying to understand their issues, trying to seek guidance, so that took a lot of my time. So I really didn't have exact reflection time, because I've been in it for a very short time. So I think I am in no position to judge or make any comments on that.
Since you are the health minister, so what would be some of your priorities for the health system?
I think something that I'm always grateful for is our monarchs. They had amazing benevolent vision for the nation. I think we are probably only country in the region where health services are free. And every day we get up and I pray that, we are so lucky to be born in this country. And then secondly, we have a very strong civil servant. So I feel, with the visionary guidance from His Majesty the King, a very strong civil servant, a very compassionate people, I feel we cannot go wrong. So we are very excited because I think it's only about putting all the pieces together. We have all the ingredients, we just have to make it work.
As a lone female in the cabinet, at times do you worry in the male-dominated cabinet? Would you be able to raise the voice of our women? You are the voice of the women in the cabinet, as well as as a parliamentarian as well.
Yeah. This is something very interesting that I've been often asked, and I realize that it really depends on the cabinet. When you say cabinet, cabinet is a team. We are all, regardless of our gender, we are all on equal footing, and we work as a team. We shared common goals, common objective, so we get equal. I think there is no, within the cabinet, there is no discrimination as such. So because we work as a team, and every team member participates equally. So I don't think so because I'm a woman that I feel, because I'm also a very vocal person. And I often, I think, true to my father's statement, I'm a very strong-headed person. So I think that is something I don't actually see it as a challenge.
As a health minister now, how well informed are you about the health system in our country? And what do you think is the serious? What do you think is the most serious concern when it comes to public health now?
I think I'm actually, although I have worked in the health system with the Ministry of Health in the past years, I'm still learning. I'm still trying to. We have gone through consulting with various department heads and the bureaucrats there, seeking their guidance to guide us. In terms of public health, I think because healthcare is free, I think one concern that we see is how can we finance our health system, our health services for the next generation. One. Two, we look at now the disease, the transition of disease from communicable to non-communicable disease. So communicable diseases, we treat them right away, they get cured. Non-communicable disease, people are on treatment for life. So then it subsequently has an impact on the cost of services. So how best can we deliver these services? So these are some major challenges I see.
For the longest time, we have been hearing whenever we ask the GDWNRH what their challenges are, they say shortage of health specialists now. As health minister, how do you intend to address these issues now?
I think these are, we are actually at the moment working on it. We are looking at different modalities because at the end of the day, we have to make do with what we have. We want to look at different mechanism of delivering services. So, so there is, to give you an example, sometimes we have this sense of equality. So this is a hospital, this is an allocation, this is what you will get. But I think it's high time that now we transition from that mode of thinking to something that is evidence-based and strategic information-based. And by this, what I'm saying is, now we want to look at, okay, if you have a BHU, what is the disease pattern there? What is the catchment area? How many people are there? And then subsequently staff them and equip them. I feel we must invest in our people. We have very competent health workers. We need to invest in them so that they are able to deliver quality health services to our people.
Yes. As of now, one of the biggest problems is the equity in the use of health services. Now, how do you intend to solve the gap? How do you intend to address the gap now?
So when you say equity in health services, what do you mean?
Because not all the people, they avail the same services, because some say if you know someone in the hospital, you get the service delivered faster. And if you don't know anyone, then you remain in the hospital seeking for the appointments and availing the service for months as well. So how do you intend to address this gap now?
I think I have also heard that story, but to what extent it's true and all that, I'm not sure. But in terms of, we really want to institutionalize service delivery. So there we are looking at efficiency. How efficiently and effectively can we deliver services to our people? And so we're looking at all mechanisms. Utmost responsibility that we have today is that we want to ensure that these are systematically done with very little interventions, that it's in the system so that you cannot manipulate the system. So establishing good practices and good system is key in Bevala. So that's what we are focusing on at the moment.
Again, when it comes to access of service, compare it in the rural and urban areas, it's different, totally different. What you get in urban, you don't get in rural areas. So how do you make sure that everyone has access to the same facilities now?
Yes, this is what we call the service delivery model. So we must now look into a different mechanism of delivering health services. A bit diversion from the traditional mode of delivering services. So just now the delivery services we have is infrastructure based. So we have JDW delivering specialty services, but I think these specialty services, for example endoscopy, ultrasound, can also be just services, not the human resource or anything, but the services then can go into the rural communities and do this. And these are mechanisms that has been proven quite effective in Medla. So we might adopt that mode of delivering services la. Because at the end of the day, the objective is that people must get the services. They don't care about having a building infrastructure and all that la. They want to get the services. So we must first accommodate that services la, and then we look at decentralization.
Lastly, again, how do you intend to ensure sustainable health financing for universal health coverage now?
Yes, so that is something, like I said, it's a concern for us, and we really want to look at it like health financing, because if we want to ensure, we are very fortunate having had free healthcare services. So our sacred, one of the utmost responsibility for the government is to ensure that the next generation also enjoys the same free services as we did, as envisioned by our monarchs. So I think in that regard we wanted to really look at health financing. Now when we talk about health financing, there are different ways of looking at health financing. We want to look at whether how can we raise funding for health services, how can we raise fund for health endowment funds, and at the same time, what are the resources we have. We want to calculate how far can these resources accommodate our health services.
Now, what visible changes do you assure at the end of 5 years now in the health system?
I think enhanced services. So people, regardless of where they are, that they are able to access services and enjoy equal services as people say residing in Thimphu. That one was first. Second, that to some extent we have that we are able to ensure sustainability of health services in the country for the next generation. Third, I think in terms of service delivery mechanisms that are streamlined so that people have very little barrier to services.
Now again back to politics. Now, what is one thing that you intend to do differently as a minister from all the ministers Bhutan had so far?
In politics?
Yes. As a minister also, now what is something that you intend to do differently compared to all those ministers we had so far?
I think every minister, I must say, must have done something very different in their own capacity. For me, I feel something that I'm very passionate about is be that in health sector or any other sector, having a vision for the country. So that it doesn't matter which political power comes into power, which political party comes into power, that we all share a common vision for the nation, which in that way we want to put the interests of the nation first. So that is what I personally would like to see.
As a lone woman in the cabinet again, now how do you think, even despite much awareness about women, asking women to come forward and join politics, yet we have very minimal number coming forward to join politics. Is politics something very daunting for the women to be part of it?
I think it's a very interesting question for someone who has been had so little experience in politics. But something that I'm a researcher, so I look at numbers, and if you look at number of women who participated, it's 10, and of 10, 7 getting elected, 70%. So I feel if women do come forward, I feel unlike in other countries, I think our people will support. I think gender doesn't play a role in there. But now the second one is making sure that we create enough enabling environment for women to come forward. Now, I shared this thought during the BNU conference as well, is, today if you look at it, if you compare political institution to civil servants, people have so much pride in joining civil servant. They say, oh, I'm a civil servant, I qualify to be a civil servant. But that same attitude is not there for joining a political party. So then I feel we have the utmost responsibility to build the institution of political parties, so that they themselves establish in their right as an institution that people are proud to be associated with. Because when you think that today being part of the political system, I feel it is such an honor and the highest institution you can be in governance to serve the country. And to me, it's an honor and a privilege. But when people join, they don't think that way. People say, politics, why you want to join politics, you know? People say like that. So that's why I think we have the utmost responsibility to build the institution of political parties so that they are looked at in its right, something to aspire to.
Yes. But since you have been in the field now, you would know, like, as a woman, what's the most challenging thing to be a politician now? What do you think are some of the reasons that is holding back our women to join in politics now?
For me, like I said, it's such a short experience I have. I'm sure other women who have been in politics for longer might have other challenges. For me, I think personally, I think the challenge is more about, of course, we have the biological or the geographic challenges, as you know, you cannot go in the middle of the night, or you know, you need a friend. These are very practical challenges. But now, in terms of convincing the people and all, I really don't foresee a lot of challenges. But I think people are now warming up to it, seeing women in leadership position. And I think we all must keep in mind and be patient that democracy is very young in Bhutan. I think Netherlands, I think it has taken them almost 100 years. And we are only 15 years right now into the democratic process. And now people are seeing more with the Boduji in the past, you know, and a lot of our honorable MPs, the eminent members, you know, making decisions, and even in civil servants, more in private sectors, you know. So people are warming up to seeing women in leadership position, and this I feel will eventually come in, and people will it will sink in that, oh, women can also be leaders.
At the moment, when you talk about gender equity, there is equity, but then when you, in reality, when you actually get into the field and do such things, if you look at the responsibilities men and women carry, we are always the ones who are who have to carry more responsibility, be it at home or looking after your children or whatever. So these are some of the things that are holding back our women from taking greater roles and responsibilities. So you as a parliamentarian now and as a minister, how are you going to raise these voices of our women, making the environment more conducive, providing help for them and all those things?
I think this was a question that was raised earlier as well during some of my discussions, and I look at it, creating enabling environment for women. For example, for Drukin Amrut Sokpa, it may not be, we didn't package it that way, but if you look at, for example, class 10 cutoff to class 11, majority of them are girls. So then, you know, not having that cutoff point will encourage more women more girls to get their high school diplomas. One. Two, our pledge on the maid as well. This will greatly benefit women normally as a working mother, because you have, like you mentioned earlier, we have so many other responsibilities beside our 9-to-5 responsibilities. So in that way, I think having that support would greatly benefit women. And studies in the past have also shown that majority of the women who resign their jobs, young mothers, are working women. So this will also greatly benefit women in general. So these are some of the enabling environments. So we are in the process of developing it. So as we move forward, it's not all set in stone. So we are flexible. We want to feel the pulse of the nation and then strategize so that it has the maximum impact for our people.
We have a very young set of cabinet ministers, so they are skeptical as on how you all can carry out the duties. So if you could share your own thoughts about this now, having a young cabinet.
I don't know, to me, I share the same sentiment as our Honorable Luncheon. I think age should not be a factor. Today, globally, if you look at it, we have very young prime ministers. Look at Canada, look at Italy, very young and leading, you know, world's greatest economies. We have very young, dynamic leaders. I think leadership comes from where your heart is. If your heart is in the right place, if you're given the responsibility, I feel Bhutanese people are very competent to shoulder the responsibility, no mila. So age for that matter, age or gender is never a factor.
Your final words to the viewers now.
Nasla. Again, I would like to thank everyone for their trust and confidence in us to serve the nation for the next 5 years. We are honored and privileged. I would also like to thank BBS. And I would also like to inform the viewers that at the moment we are very actively and thoroughly looking at the plans, 12 5-year plans, and really strategizing how best we can implement the plan, and looking at various marrying our pledges with the plan, and soon we will be able to communicate that to the public. But we are all working as a team for the benefit of our people and our nation at large. So thank you so much for the opportunity, and I really enjoyed it.
Plus, thank you so much, Your Excellency. Thank you so much for taking out the time to talk with us despite your busy schedule. And thank you all the viewers for watching us.